My name is Kayla Sedbeck and I'm performing an HEENT assessment on Michael here for nursing 383. First, I'm going to wash my hands. Next, I would do a general assessment like I did in the first video that was submitted. Next, I'm going to inspect the skin and nail beds. I'm going to inspect for the color. I'm going to see if there's any lesions. I'd be looking on his back if he was disrobed. I'm going to check his nail beds to make sure that they are normal. And they are. And I'm going to check if this patient has any edema. I'm then going to palpate the skin for any moisture. I'm going to palpate the texture, the turgor, and the temperature. Now I'm going to move to the head and the neck. I'm going to inspect and palpate the hair here. I'm going to see if it's dry, moist, check for hygiene, or if it's brittle. I'm also going to inspect the scalp for any lesions or discoloration, and I'm going to palpate the head now for any pain. I'm then going to look at the facial features for symmetry and size, and that's good. And I'm going to palpate the facial bones here. I'm going to now palpate the temporal mandibular joint here, and I'm going to have you open and close your mouth. And close, open and close. Okay, and I'm looking for a click there, and there isn't one, so that's good. I'm going to then palpate the temporal arteries and the frontal and submaxillary sinuses, or the frontal and maxillary sinuses. I'm now going to look at the eyes. I'm going to look at your eyebrows and your eyelashes to make sure that the hair is equally distributed. I'm going to look at the upper and lower eyelids, and I'm just going to pull down your lower eyelids here. I'm looking at the conjunctiva and your sclera and your iris. And that is all good. I'm then going to move to the ear, and I'm going to inspect it and palpate. I'm also looking for symmetry of the two ears, and I'm looking for if there's any pain when I pull back on the ear. There's not. And if I was using an otoscope for this assessment, I would see the tympanic membrane, and I would be looking for the malleus umbomanubrium and the short process through the translucent membrane. Now I'm going to move to the nose. I'm going to inspect and palpate the nose. I'm going to check for nasal patency. I'm going to have you close 1 nostril with your finger and breathe in and out. Okay, good. And then on the other side. Okay, good. All right. And I'm going to take this flashlight and I'm going to shine it up your nose here. I'm looking at the septum, the turbinates, and the nasal mucosa. All right. And that all looks good. I'm then going to inspect the mouth and the pharynx. And I'm going to have you open your mouth here. Okay. And your lips look pink and moist. And I'm going to look at the gums. I'm looking at the teeth for dentation. Actually, I can use this so you can see better. And that looks good. And I'm also looking at the oral mucosa, and that's nice and moist. I'm then going to have you open your mouth wide. Okay, and his tonsils would be, I'd rate them at a 0 because they have been removed. I'm going to have you say ah. Open wide and say ah. Okay. And I'm looking at the uvula, and then it's midline. I'm then going to move to the neck, and I'm going to be looking for any masses, scars, or lesions on the neck, and Make sure that it's symmetrical. I'm then going to palpate the sinuses. I'm going to palpate the preauricular nodes, the postauricular nodes, the occipital nodes at the base of the skull, the tonsillar nodes, the submaxillary nodes, the submental nodes, the anterior cervical nodes, the posterior cervical nodes, and then the supraclavicular nodes. I'm going to have you shrug your shoulders up. Okay, I'm going to feel here. Okay, good. Relax, and I'm going to feel your carotid pulse, one side at a time. And then I'm going to inspect and palpate the trachea to be sure that it is midline. This completes the HEENT assessment. I would then wash my hands.